Today on 3rd of October 2023 at Naraina Medical College and Research Center, Panki, Kanpur, there was this pre-university examination of Anatomy Paper-1 Part-1. Part-2 I'll be uploading separately. This exam was for students admitted in MBBS 2022 batch. So this exam was of 3 hours and the maximum marks allotted to this part 1 was 50. So this question number 1 here is on clinical anatomy, and this was of 15 marks having 3 subparts of 5 marks each. This question is, a patient is diagnosed as a medial medullary syndrome on the right side. That's it. So you should know what is medial medullary syndrome. One thing. Then what is the effect on tongue? You have to describe this. Then name the nuclear column to which the 12th cranial nerve belongs and name the muscles of the tongue. So it's a very precise short question where you have to write precisely just whatever has been asked. You don't have to elaborate the details. I believe not more than 5 minutes is required to solve this question. But here I am to explain you this. So remember that medial medullary syndrome, what is that? It is the ischemia of the medial portion of the medulla oblongata due to the blockage of the anterior spinal artery. So what happens is the nuclei of the medial portion of medulla, they get ischemic, and that leads to gradually irreversible changes. So what are the structures there in the medial portion of the medulla at the level of pyramids? One thing, of course, there will be the pyramidal fibers, the corticospinal fibers descending down to reach the opposite side of the spinal cord. Then there is medial lemniscus pathway, which is actually the continuation of the dorsal column. The first order neurons from the spinal cord, the dorsal horn, they continue in the fasciculus gracilis, fasciculus cuneatus, relay there in the nucleus of cuneatus and gracilis, and then they cross to the opposite side of the brainstem. From there they ascend up in the form of medial lemniscus. So these are the second order neurons carrying sensations of conscious proprioception, pressure, vibration, 2-point discrimination, right? So these second order neurons are present there in the form of medial lemniscus, which ascend up to relay in the thalamus, and the third order neurons from thalamus reach up to the cerebral cortex. And remember, there is a somatotropic representation in this tract. The third thing important you will find there is a longitudinal nucleus of 12th cranial nerve, which is present both in the open and closed portion of the medulla. Like partly the upper portion will be visible floor of the fourth ventricle, and partly will be extending down below also. So at least you'll have to think about these 3 things while describing the medial medullary syndrome. So what will happen is that there is contralateral hemiplegia due to the damage of the pyramids of the medulla oblongata. Then there will be loss of the sensations of vibrations and position due to damage of the medial lemniscus, as well as there will be paralysis of the muscles of the tongue. Remember, out of the 8 muscles of the one side, 7 muscles are being innervated by this 12th cranial nerve, except the palatoglossus, which is being innervated by vagoaccessory complex. And out of those 8 muscles, remember, the bulkiest muscle is that of genioglossus, which is also called as life-saving muscle, because it keeps your tongue protruded, like, pushed forward. It actually prevents the falling back of the tongue, and that's why it's also called as a life-saving muscle. So as they've mentioned is that medial medullary syndrome is of the right side. So it means that genioglossus, including the 7 muscles, will be paralyzed on the right side. So what will happen, the rest of the muscles of the opposite half of the tongue, that means of the left side, will be normal and will retain their tonicity. So because of the tonicity of the left sided genioglossus and flaccidity of the genioglossus of the right side, So tongue will now protrude towards the right side. That means the tip of the tongue on protrusion will get protruded to the side of the lesion. That's right side in this question. Now talking about name the nuclear column to which the 12th cranial nerve belongs. Remember, it's the most medially placed functional column in the brain stem, which is general somatic efferent GSE, which includes the nucleus of 3rd nerve, 4th nerve, 6th nerve, and the 12th nerve. So the answer here will be general somatic efferent. Now name the muscles of the tongue. You know there are 8 muscles, 4 intrinsic, 4 extrinsic. The intrinsic muscles are the superior longitudinal, the inferior longitudinal, transverse and vertical. And the extrinsic muscles are genioglossus, hyoglossus, palatoglossus, styloglossus. That's all you have to write. Don't bother writing much in this question. Then there was this question number 2, where you have to write briefly upon. There are 3 questions of 5 marks each. Question number 1 here is auditory tube. So you have to write here about the bony, the cartilaginous portion, the orientation, the communications, and the clinical and applied portion. Don't forget to mention about the length of the different structures, right? The next question is about microscopic structure of the submandibular salivary gland. So you have to draw the diagram, and remember, lining epithelium of any salivary gland is simple cubical, right? They become simple columnar while in the phase of active secretion, and there are 2 different type of acini. Basically, it's a mixed salivary gland. So to show both the serous and the mucous acini. Serous acini will be taking a darker stain. There will be central placed nucleus, rough endoplasmic, and the vesicles towards the luminal surface. Mucous acini, the nucleus will be basal, filled with mucin containing vesicles. They are not taking good stain. And don't forget to mention about the crescent of Giannuzzi or the demilune of Hayden-Ash. That's an identifying feature for submandibular salivary gland. So this is important here to explain. Next question is structures derived from the second branchial arch. So it means you have to describe the skeletal derivatives, the muscles, the nerve supply, the blood supply, and the cartilage of this branchial arch. My purpose of uploading this question is just to explain you the MCQs. I believe you can read all these questions from the book. Write short answers on arterial supply of palatine tonsil. This is a simple question of 2 marks. We have to draw the diagram and just show the blood supply of palatine tonsil, the arteries. Because these are 5 questions of 2 marks each, right? So you don't have to go into elaborate details. Just draw the diagram and pinpoint the name of those arteries supplying the palatine tonsil. Then action of medial and lateral pterygoid muscles. This also is given there in the books. You should describe this. Folds of the dura mater, easy one. Remember the fox cerebri, fox cerebelli, tentorium cerebelli, and the diaphragma celli. Spinal lamellae of Rexid. Again, this is simple. Just have to draw the diagram and explain all the lamellae. Gastrulation, again, the formation of the trilaminar embryonic disc. Then here we come to the MCQ section, where there are 10 MCQs of 1 mark each. So the first MCQ is, which of the following muscles does not help in opening the oral fissure? Does not. Means all the muscles mentioned below are helping to open up the oral fissure. The dilators of the oral orifice. Levator labii superioris alignizai. It does helps to elevate the upper lips. Depressor labii inferioris, it pulls the lower lips downwards. Mentalis has no role on the opening of oral fissure. It doesn't act on the lips, while risorius pulls both the lips laterally, thereby making a face, the oral orifice, such as if you were trying to brush your teeth. So remember, the answer here will be mentalis. Mentalis actually pulls up the skin of your chin, thereby giving an expression of doubt. Next question number 2. Which statement is wrong regarding the external or the superficial features of the face? Select the wrong statement. Angle of mouth usually lies just in front of the first premolar tooth. This is correct. The lips normally close the mouth along their black margin. Now, this is a wrong statement because black margin is the outer margin of the lips, which actually join the skin of the face. There's another margin called the pink margin, which is the inner margin of the lips at which the two lips join, and that is the mucocutaneous junction of the lips, right? So remember that the lips close at the pink margin, not the black margin. So I believe this should be the answer. Let's read the choice C and D also. Lateral to the lacrimal caruncle, the bulbar conjunctiva is pinched up to form a vertical fold called the plica semilunaris. This is correct, and all these options are actually to make you learn about these minute features of the face. The free edges of the eyelids have a rounded outer lip and a sharp inner lip. This also is a correct statement. You can correlate all these options given here from the book. MCQ number 3. Which of the following arteries is not a branch of ophthalmic artery? Anterior ethmoidal artery, supraorbital artery, infraorbital artery, supratrochlear artery. So you know that ophthalmic artery in the orbit gives three branches: frontal, lacrimal, and nasociliary. Anterior and posterior ethmoidal arteries are branches from the nasociliary artery. Supraorbital artery, supratrochlear artery are the branches from the frontal artery. However, infraorbital artery is not a branch of ophthalmic artery. Infraorbital artery is actually a branch of maxillary artery running in the floor of the orbit, then passing through the groove, then a canal, and emerging out through the infraorbital foramen below the inferior margin of the orbit. MCQ number 4. Transverse facial artery is a branch of facial artery, maxillary artery, superficial temporal artery, lingual artery. So this you should know that it's a branch of superficial temporal artery. Question number 5. Which statement regarding the thyroid gland is correct? It is larger in females than males. This is correct. False capsule is the peripheral condensation of the connective tissue of the gland. No, it is the fibrous capsule being formed by the pretracheal fascia. That's called the false capsule. The one they have mentioned is the peripheral condensation of the connective tissue is actually the true capsule. Then dense venous plexus is present between the true and the false capsule. No, this is a feature of prostate gland. Here in thyroid, the dense venous plexus is present within or below to the true capsule, that is the inner capsule. So below to that, within the parenchyma of this thyroid gland, you find is the dense venous plexus. That's why while doing thyroidectomy, you have to take care of this. Choice number D. Its medial surface is related to the middle and inferior constrictor muscles of the pharynx. No, remember that its medial surface is related only to the inferior constrictor and the cricothyroid muscle. So the answer to question number 5 is A. This time I am solving this from my mobile. That's why I'm finding it a little inconvenient, and that's why I'm getting precise. MCQ number 6. Which statement is wrong regarding contents of the orbit? Wrong statement. Lacrimal nerve receives postganglionic parasympathetic fibers to the lacrimal gland via a communication from the zygomaticotemporal nerve. It is correct. Secretomotor fibers to the lacrimal gland come from the deep petrosal nerve. This is a wrong statement, and that's why this becomes the answer here. Remember that the secretomotor fibers to the lacrimal gland come via the greater superficial petrosal nerve, which relay in the pterygopalatine ganglion, the preganglionic fibers. Choice number C is frontal nerve is the largest of the three terminal branches of the ophthalmic nerve is also correct. Now look, these options are actually to make you learn and revise the minute details of the contents of the orbits. Long ciliary nerve carries sympathetic fibers to the dilator pupillae and supply sensory nerves to the cornea, iris and ciliary body. This also is correct. I'm helping you here to remember that there are long and short ciliary nerves to the eyeball. Remember, long carries sympathetic fibers because that dilates the pupil and increases the diameter of the pupil. That's why it's long ciliary nerve. Short ciliary nerves carry the parasympathetic fibers for the constrictor pupillae. So they constrict the pupil and decrease the diameter of the pupil, and that's why they've been carried in the short ciliary nerve. This is just to make you learn about the long ciliary nerves and the short ciliary nerves. Remember this. Question number 7. Which statement is wrong regarding the openings, that is drainage of the paranasal air sinuses into the lateral wall of the nose? So you have to select the wrong statement. Anterior ethmoidal air sinus opens into the middle meatus of the nose is a correct statement, and you have to select is a wrong statement. Middle ethmoidal air sinus opens into the middle meatus of the nose. Again, this one is correct. Posterior ethmoidal air sinuses open into the superior meatus of the nose. This also is correct. Look, this is how you're going to revise the openings of the paranasal air sinuses. So you have to actually read all the options carefully. Sphenoidal air sinuses opens into the superior meatus of the nose. This is a wrong statement and this becomes the answer here. So remember, sphenoidal air sinuses opens into the sphenoethmoidal recess, which is the space above the superior concha towards the roof of the nose posteriorly on the lateral wall. MCQ number 8. Functionally, the pterygopalatine ganglion is related to. They've asked this functionally. Facial nerve, maxillary nerve, mandibular nerve, lingual nerve. So one thing you should know that structurally, like anatomically, when you see with your eyes, you find that this pterygopalatine ganglion is suspended by its two roots from the maxillary nerve in the pterygopalatine fossa. But functionally, when they're asking is means the fibers which are relaying there, because it's a parasympathetic fiber, right? So the preganglionic fibers will synapse with the postganglionic fibers, right? So those fibers are actually coming from the facial nerve. In one of the questions above just now, I have explained that the greater superficial petrosal nerve fibers, they are coming to relay here, and from here onwards the postganglionic fibers via the branches from the maxillary nerve will get distributed to supply the lacrimal gland, the mucosal glands of the nose and the pharynx and the palate. So the answer here will be facial nerve, but structurally it is related to maxillary nerve. Remember this. Question number 9. The growing end of ulna is weight bearing end, proximal end, distal end. Both the ends grow equally. So remember that the growing end of ulna is the distal end, which is a narrower end, tapering end, but it does not participate in the wrist joint. So that is not the weight bearing end. Remember, the weight bearing end of ulna is the proximal end, which articulates with the humerus. Well, there is a video where I have explained all the details about the growing long bones, and I've attached the link in the description box. You can watch this video. Question number 10. Which of the following is an example of an elastic cartilage? Nasal septal cartilage is actually a hyaline cartilage. Thyroid cartilage is also a hyaline cartilage. Arytenoid cartilage again is a hyaline cartilage. Epiglottis, remember, is an example of elastic cartilage. So that's all in this question paper.